Hello, everyone. I'm Nika Thuda, board chair of Women in Health Together for the Future, and I welcome you all to to a very exciting webinar. And I'm thankful to all of you that you have registered for this webinar. It shows your interest in the issue, very important and pertinent issue, and of course. Uh, in WHTF webinars, and I think it's a delight to see so many of you right now, with us. Um, most Just to introduce WHTF, we started in 1991 as a task force, and interestingly, we started in no other country than Nigeria. We started in Ilorin, Nigeria, and it was a very small task for group members. But today, then we moved on. It was in 2019 that we established ourselves as an independent entity, and we have registered in South Africa, and our Western Cape University is our host. That means we have in collaboration with Western Cape University, and Community of Health Sciences has been very kind and generous, and we have an office. We have our office in that faculty. Thank you so much. And I should just request you. You will very soon find a link in the chat. That is our feedback form. And if you fill our form, you will get a certificate for your attendance for today. So I request you for that. Please use the link for the certificate, and also be muted when the speaker is, delivering her lecture or presentation. It will be, it's just a request to you all. Okay. Uh, sh- Now I have the pleasure of introducing Dr. Anter Endep. She is going to be our moderator for today. Dr. Godwin has excused because of some other important work that he had to leave for. So Dr. Enter also is our member, is WHDF member, and she brings with her 20 years of experience in public health, and she has held leadership position and consultancy positions, and she has been a trainer on gender-based violence and female genital mutilation, and she has supervised candidates, health professional students for their thesis, and she's been a mentor and probably the right person to be here for our webinar. And the webinar is, of course, Empowering Tomorrow's Leaders, a comprehensive approach to gender-based violence prevention among secondary school students in Nigeria. So I request Dr. Antar to please, it's your take on, and then introduce our guest speaker for today. Dr. Antar? Dr. Antar, are you there? Have we lost her? I think we've lost her or something. She lost her internet connection, is it?
I'm checking. We may have
Yeah.
lost her. I also want to point out that this was one of our mini grants that sponsored the Esther's work. And
Okay.
so we're very proud to be presenting that. She's not here, so I think you're going to have to go ahead.
Okay, so it's my privilege to, since there's some internet issue with our moderator, so I'll just move on with the speaker's introduction. So Dr. Esther N. Umahi, she is in the Department of Public Health. She's a faculty member of Taraba State University, Jalingo, if I'm correct. And she has recently done her PhD in health promotion from Ibadan University. So that's again, big feather in her cap for all the work she has done. And she's dedicated to community health, and her focus is on women's and adolescent health. And her research interest includes public health education, health promotion, gender-based violence prevention, and she has published extensively on women's health. And as I said to you earlier, also she's a member of WHDF, and that makes us very proud of her, of all her accomplishments. So I can now request Esther Umahi to please start your presentation. Dr. Esther, is she there?
Yes, I am here.
I'm relieved. I'm relieved. Okay.
I'm
Please
here
go
with
ahead.
you. Okay,
Yeah.
okay, I will share my slide.
Okay, you can make your when you presentation, and then after the presentation we'll have question and answers. Okay, it's a discussion more on your presentations and generalization of your presentation. Okay.
Okay, okay. Hello, everyone. Welcome to this webinar presentation. Thank you for joining. I'm delighted to share with you a comprehensive approach to preventing gender-based violence among secondary school students, specifically focusing our work in Ohozara, which is in Ebonyi State in Nigeria. This work was made possible through Women and Health Together for the Future expanded mini grants, and I am grateful for that support and funding. Specifically, I appreciate the mini grants committee members for giving me this privilege of receiving grants for this work. The title of my webinar presentation today is Empowering Future Leaders, a Comprehensive Approach to Gender-Based Violence Prevention among Secondary School Students in Ohozra local government area that is in Ebonyi State in Nigeria. This is our research journey, the outline for the presentation. Gender-based violence in schools is not just a local problem. It's a global crisis that affects millions of children worldwide. And according to WHO, approximately 246 million children experience school-related gender-based violence annually. And that is nearly a quarter of a billion children whose education and development are undermined by violence. And also research shows that victims of emotional violence are twice as likely to drop out of school. Just think about this for a moment. Violence doesn't just harm students in the moment, it derails their entire educational trajectory and future prospects.
برضه رسالتها عم حال.
So, violence, we know gender-based violence manifests through bullying, psychological abuse, sexual harassment, and intimidation. And it creates an environment of fear that fundamentally undermines development. And schools actually should be a safe space for learning and growth. But for too many students, they become sites for trauma. And most of these cases go unreported in Nigerian schools, and that is the danger that is in it. And so the cycle continues. So from the very beginning, we knew that understanding and addressing gender-based violence would require multiple lens and methods. So we designed a comprehensive three-phase approach to tackle this problem in this locality that we selected. So we conducted at the first phase, we conducted a qualitative study. That's a focus group discussion with students, and then key informant interview with teachers across the 4 secondary schools that were selected in this area. So we needed to understand the lived experiences. We needed to know the voices that are on ground. We needed to know, because numbers alone wouldn't tell us the why behind the violence. We need to know, or we need to listen to know, to know the experiences that are on ground. Then the phase 2 of it, we did a baseline study where we studied 300 adolescent students to measure their knowledge, level of knowledge, perception, their practices, their self-efficacy, and the experiences of these students. This established our starting point and gave us the data that we needed to understand the scope of the problem. And then the third phase is the intervention phase, where we implemented a quasi-experimental design involving 199 students, 100 students in our intervention group, and 99 students in our control group. The intervention group received a 12-week peer-led educational program, and this allowed us to measure the impact of our approach. And with this design, during the first phase, students shared powerful testimonies with us in our focus group. One of the students, a female student, during the focus group, told us, and she said, I rejected a senior's request for friendship, and I became his worst enemy. He would always punish me for no just cause. And thinking of this, the statements exercise these students' fundamental rights to say no to a romantic relationship. And as a consequence, he faced an ongoing harassment and punishment. And this wasn't just a one-time event. It was something that was continuous. And it's because a student dared to set a boundary, she is now being harassed by her own colleague because he is of the male gender. So, and this wasn't an isolated story, because we analyzed our focus group discussions and other clear patterns emerged. We saw senior-junior power dynamics being abused, with older students using their positions to harass younger ones. We also documented rejection-based violence, where violence basically followed romantic rejections. We heard about physical intimidation, where boys use their physical strength to control or threaten girls. There was also sexual harassment that was reported among the multiple schools, about the 4 schools that we visited and conducted focus group discussion. So these patterns were identified during the focus group discussion. We also was able to conduct a key informant interview with the teachers, and one of the teachers also gave us insights that students might not fully articulate because they are living within this cultural context every day. So one teacher from one of the schools said, and he told us, in this part of the world, the society supports it. Even at home, females are denied certain rights. For instance, they are not allowed to have inheritance of land traditionally, except one goes through the law court, because ownership of land is assumed to be a male thing. That was the teacher's report from the interview we had. This is an important context for us because GBV in school doesn't exist in a vacuum. It's reinforced by broader societal structures that systematically give males the privilege and then denies the rights of females. When a society tells the boys from childhood that they are superior, why when families denies girls inheritance, then communities accept these inequalities as tradition, and it creates the condition where gender-based violence can flourish. So teachers identified several other factors that enabled GBV, that traditional beliefs about male superiority are passed down through generations, and gender discriminatory practices like the inheritance laws he mentioned hierarchies are in everyday interactions exist. So there's this reinforcement. Those are the patterns, cultural factors that really make the manifestation of gender-based violence very prominent up to the school level, not just in the community. So those were the facts, the summary of the facts that we got from our qualitative study. We then moved to the second phase of our study that we looked at the awareness, knowledge, attitude, perception, and practices, even experiences of gender hundred adolescents across the sense of the student had if just more than half, a little above half of them were aware. Now, among the 128 students who had heard of GBV out of the 300, you might think awareness would translate to understanding, but it didn't. Instead, 71.1% of those who were aware still had poor knowledge of gender-based violence. And then, not just that, 98.4% did not recognize verbal abuse as a form of gender-based violence. They understood physical violence like beating, like hitting, but the psychological and emotional dimensions of gender-based violence were almost completely invisible to them. This is why our qualitative research was very important, because students were telling us about being tongue-lashed by partners, about controlling behaviors, about emotional manipulation, but they didn't have a framework for understanding these experiences as violence. Students also struggled to identify other forms of GBV, like most didn't recognize that denying someone access to education based on gender is a form of gender-based violence. They didn't identify harmful traditional practices as GBV. It's as bad as that, even among those, just the few of them that are aware of this gender-based violence. And the belief students held about GBV were more concerning than their lack of knowledge, because their beliefs actively enabled and perpetuated violence. For the perception of GBV, student perceptions and beliefs, overall perception, 83.6% of the students have poor perception about gender-based violence. Let me even break it down so that we actually understand this problem very well. That 88.9% believe that confident and assertive people are not likely to experience gender-based violence. This is particularly dangerous because it's a myth, and because it suggests that victims somehow invited violence through weakness. It places the responsibility of potential victim to be strong enough to avoid violence, rather than the perpetrator to stop being violent. So it's not a good perception. It's very dangerous and it's very common. So we also 83.6% also believe that if someone is wearing a revealing clothes, then they are inviting gender-based violence. This is a victim blaming dressed up as prevention advice. I'm like you are telling somebody dress very well so that you will not be harassed. Yeah, it's good to dress very well, but that's not the reason why another person should harass, I mean, another gender should harass the other gender. It suggests that women and girls control whether they experience violence through their clothing choices, which is fundamentally false and deeply harmful. Then we also saw that 82.8% agree that victims of gender-based violence probably exaggerating how bad it is, thinking that what this means reporting that if a student experiences violence and believes that others will think they're exaggerating it, then why would they report? And this belief creates silence. When they cannot report, they will just keep silence. So victim blaming beliefs normalize the violence and discourage reports. That's the finding from our perception measurements, that students in this particular locality in Nigeria, they blame those other students who have been harassed, not even thinking about that the perpetrator shouldn't have equally done that. Then we also assessed sexual violence and found out that 24.2% of these students have experienced sexual assault. And this is very alarming. Out of those who are aware of domestic and gender-based violence, 24.2% of them had experienced sexual violence. And let me even be specific about what that meant. It means that 21.9% had been physically forced into sexual intimacy, and then 14.1% reported forceful touching of breast, and then 10% reported forceful touching of private parts. And in 100% of the cases where students identified the perpetrators, it was not a stranger. It was not necessarily a romantic partner, but a friend. A friend is the perpetrator. And when we further asked them about reporting, this student that had experienced sexual assault, we asked them if they reported. 96.8% of these victims said they reported the assault, and it sounds encouraging at first. But then we asked about the outcome of the reports, but 65.6% of those reported cases remained unresolved. So what does this translate to? It means those others who are facing this challenge will not even say anything. So silence continues. They won't say anything since the cases were not resolved. So it creates barrier for reporting. Then we also I asked these students why they did not report, the barriers to reporting. And we found out that 69.7% of them mentioned that that is because of shame. That's why students don't report, because of shame. Then 53.6 talked about fear of being killed or threats. Then 50.5% say parents would be disappointed. And then 39% says stigma or discrimination or others. So we find out that there are so many challenges that were causing these students not to open up, and they were all dying inside, even when they do not really understand what they were going through. So the last phase of our study is the intervention intervention phase. During the intervention phase, we recruited about 200 students for the intervention. But we had, at the end of the study, we had 100% retained at the intervention group and 99 retained in the control group. We had one that dropped. So we had a 12-week educational session for the intervention, and we actually selected out of all the approaches that were the options for us to take. We chose to do a peer-led education approach. So we was focused, we trained about 20 peer educators for the intervention. We first did that. So, and we use peer-led education approach because young people can be trusted. Then we build leadership capacity in them, we create sustainable models, and then respect adolescents' agency. So in the intervention manual that we developed, we had about 4 sessions for the comprehensive understanding of gender-based violence among students. We used our 12-week training manual was carefully structured. It focused on gender foundations, helping students to understand the difference between biological sex and social constructed gender roles. We also explored power dynamics relationships, teaching students to recognize healthy and unhealthy patterns of relationship, and then focused on building self-efficacy, giving students the confidence to take action. So we, as I said before, we chose a peer-led approach, and this was very strategic and intentional because young people can be trusted. So after the training, we have the results of the training. It was a very impactful training, both for the trainers and even the facilitators, because we learned from the students and also the students learned from us. We evaluated the students' knowledge before the intervention and after the intervention. In terms of knowledge, we recorded a 26% improvement in students demonstrating good knowledge of gender-based violence. Students who completed our program could now identify all forms of GBV, not just physical violence, but emotional abuse, controlling behavior, sexual harassment, and even harmful traditional practices. Then for the perception variable, we also measured, and then the results revealed that only 13% of intervention students had good perception about GBV after our program. Then that's the largest measure because we had a 47% increase in perception, good perception. Then we also, the self-efficacy measures, students' confidence in their ability to take action rose from 53% to 77%, and that gave us a 24% improvement in the confidence of these students to be able to tackle or prevent gender-based violence. That's a very, as far as data is concerned, a very good record for our intervention. But then we also compared with the control group to find out that the differences in the control group and the experimental group were very clear because there was no change in knowledge of the control group. There was no change in a slight change in their perception in the control group, very slight, not comparable, and not even significant. So for our knowledge transformation, students could only identify all forms of GBV. They understand causes, the consequences, and they knew where to seek help. Then for the perception, more positive attitudes towards reporting, they reduce victim blaming, there's enhanced perpetrator accountability, and they have confidence to recognize GBV, so to support their friends and intervene and seek help in case they needed that. Then we also did an interview and focus group discussion. We interviewed students after the program to know how they felt about the program. And one of the students, a female student, said, and I quote, he said that before the training, I thought GBV was only physical beating. Now, I understood how words can hurt just as much, and I know how to help my friends. And this captures the knowledge transformation that we saw, from understanding violence as only physical to recognizing psychological and emotional abuse. But notice what else she said. She said, I know how to help my friends. That's self-efficacy, that's agency, and that's empowerment. It shows that these students have been empowered, they have gained confidence. Another male student also said, I learned that being a man doesn't mean dominating others or using violence. Real strength is respecting others and standing up against violence. And this is also a transformative report because it directly challenges the toxic masculinity that fuel much of GBV. This young man is redefining what it means to be strong. He's rejecting the cultural script that ties manhood to dominance and control, and he's doing it in his own words, arriving at these conclusions through peer discussions and reflections. That's what it is because of the peer influence on these participants. Then another female participant told us, he said, the best part was learning that I have power to create change in my school. I am not just a victim anymore. I can be part of the solution. Just listen to, he said, I'm not just a victim. That shift from victim to agent of change, that's what prevention education should achieve. It doesn't deny that victimization happens, but it refuses to let victimization be the end of the story. She says you have power, you have choice, you have voice, and you can create change. And that was the testimony of these female students. This is just few of the testimonies that we got from the interview with the students after the intervention. We also were able to intervene the teachers, and one of the school administrators told us, he said, the change in these students has been remarkable. They speak more confidently about difficult topics and support each other in ways I have never seen before. That was the report of a school administrator who watched us as we carried out this exercise and this intervention studies. Then another teacher shared with us, he said, some of our peer leaders have become informal counselors for other students. Just last week, a peer leader brought a concerning situation to my attention that I would never have known about. So it means it's very important. Our peer educators were creating new pathways for students to access help. They become bridges between students and formal support system, handling situations with what this teacher described as a surprising maturity. Very surprising, because these students, they are very shy, they cannot talk, they cannot speak. They will just keep quiet and be dying in silence. But after this training, the peer educators did a very good work. They followed up, we were monitoring them. They were gathering their students together and speaking to them and doing their awareness program. So then the next is the impact. We're able to reach 100 students from our intervention. We're also able to reach 20 peer educators. Then we have the ripple effect because the students, the peer educators did the advocacy and awareness projects. We're able to reach 300 plus additional students that were not part of our initial intervention group. But through the effort of the peer-to-peer education, we're able to reach more than 300 students. And then we're able to create GBV clubs. We established a GBV club among these students. And then teachers also started incorporating prevention, GBV prevention in lessons, although not formal, but in their teachings, we're able to attend some of their classes. They will mention and then they will say, we have learned, and then they were including it informally in their lessons. Then the students shared knowledge with families and community awareness were also increased. Then building sustainability, as I said before, there was a formal GBV prevention clubs that met bi-weekly. Then 20 peer leaders served as ongoing advocates, teachers integrating GBV prevention into their lessons. Then building sustainability again with student-led awareness campaigns and did drama presentations and talks with their students, several of them that they did. I just have few of the pictures that are here. There was also community ownership support. Like we had a very warm historic moment in one of our outings that one community member saw what we were doing and ran inside and brought a banner that we are seeing here. Just a banner that had stop rape banner that they used years ago and gave us and say, we like what you are doing. Please use this banner and show, let people stop rape is part of it. It was very a very good moment for us that time because everybody was kind of interested in helping to prevent gender-based violence, not only in schools, but even in communities. Then for our recommendation for schools, we recommend that GBV prevention be integrated across subjects, not just in the curriculum as gender-based studies, but there's a way that the curriculum for each subject will be made that it can be incorporated into each subject. And if teachers are trained to recognize and respond to GBV, they'll be able to, it will also have great impacts in preventing gender-based violence. Then the schools can also employ guidance counselors and develop clearer policies, because out of the 4 schools that we visited, it was only one school that had policies on GBV, but there is not even well implemented. The students confirmed it that they don't, it's not implemented. Then for policymakers, recommend that this peer-led education be scaled up even in the state, because Ebonyi State is a gender-based violence state. Is well documented in some of the articles that I saw online, even in the community. So and it's reflected in our study that is also happening in schools. So policymakers can also allocate resources for prevention and then mandate comprehensive policies and support counseling services. For students should know that they are not powerless They should know their rights, they should support each other, and they should be leaders for change. And then as peer educators showed in our study, young people can be agents of change. They can drive transformative change. So we actually encountered some challenges, but we're able to come over them. Like when we came when we came to start the program, there was this skepticism amongst the teachers and the students. Though, are you coming to discuss with it? We're not supposed to discuss this kind of a thing here. But with time, they even understood that it's highly needed and they supported in the program. So the challenges were surmounted. Then scheduling constraints, because it's an educational setting, their timetable and everything were able to, flexibility, were able to arrange and then agree on a particular time that we were meeting every week. It wasn't, we're flexible so that everybody will be accommodated. Then we had limited resources. Sometimes we'll have power outage. Even the generator will not come up for us to play videos and to, but we're able to overcome using flip charts and posters and other materials that we use to overcome those challenges. So I want to thank you so much for your time and your attention today. And I want to close by returning to our title that says Empowering Tomorrow's Leaders. And that's not just a catchy phrase, it captures the heart of what we learned through this research. The students we worked with were thoughtful, articulate, and motivated. They understood the problem in their schools and communities. They can envision solutions. They are ready to be part of creating change. What they needed from us wasn't to fix everything for them. What they needed was knowledge, skills, support, structures, and the confidence that their voices matter. So when we provided those things, they took action. They educated their peers, they supported friends experiencing violence, they challenged harmful norms in their relationship and social groups. They created advocacy campaigns. They became the change agents that their schools needed. So if they can do it in Ohozara with limited resources, it can be done anywhere. This model is replicable. The approach is scalable. What is required is commitment from schools, from policymakers, from communities to take to take young people seriously as partners in prevention. Thank you very much.
Thank
So
you.
feel free to share and to ask questions, comments, and reflections. What resonated with you? What questions do you have? How and other things. Thank you very much.
Thank you so much, Esther. It was excellent. And I think it was how the work can be translated, into policy making as well as transforming minds. Thank you so much. Now I open the floor for questions to Esther. Please, could you please, any questions? Dr. Bengal has a question. Dr. Bengal, please go ahead.
Yeah, good evening, everyone. And I congratulate Esther for a nice presentation of her research. I have a few comments and a question. Uh, the comments are, we all know that the schools and school teachers have a very important role to play in preventing this gender-based violence. At the same time, parents have equal responsibility about this issue. But in these countries, it could be because of the higher level of domestic violence. Children are growing in that environment at home, and maybe they are taking it sort of what it said that normalizing the violence, and that could be the contributory factor. I have a small question, and also whether addictions in the children are also contributing to this violence. And secondly, what does law say in Nigeria about punishment to these minor children?
Yes, Esther, do you want to answer?
Yes, but I didn't get the first question.
Oh.
Please, can you repeat your first question? I didn't get.
Can you?
Maybe is there any link between addictions among children and behavior about gender-based violence, their behavior?
Okay. Well, yeah, it's though I didn't explore that, but it's possible because it's not part of the work, but I was able to find out from teachers that some of the students also indulge in substance abuse. Yeah, the teachers confirmed that, although it's not part of my work, but I then the second question is,
What does law say about
let's say,
punishing to those perpetrators who are minors but commit serious crimes? Because in our country, these minors are dealt separately in a milder fashion. So, is it the same case in your country?
yes, it is, but the problem is that they don't even get to report, and if it's reported, it will not be taken up to get to where the perpetrators will be given the right punishments.
Because in our
Okay.
country, they are sent to rehabilitation centers and where they are maybe kept for few months till their behavior improves.
Yeah, that's true. But then the problem is there's no reporting. But when there's a report, even the teachers or the parents can hide it, that it will not get to the right place where they will be taken to the correctional centers, or they will get their right punishment. It doesn't, sometimes it doesn't go far. Even if they are reported, they will kind of cover it.
Okay,
Okay,
thank you.
thank
Can I
you.
have
Thank you.
Judy? Judy, I see you have raised your
Yeah,
hand.
let me
Judy?
lower my hand so that it's out of the way. Yes, Esther, thank you so much for such a
Yes.
comprehensive project. And I'm happy to have seen it grow from the beginning and to such a successful implementation. It's very impressive. I just have a couple of questions, actually, probably three. But the first one is everything improved in the intervention group except good practices. And is that because you think it takes longer for that to happen? I'm just curious as to what your thoughts are.
Okay,
I'll ask each one so you don't have to go back and forth.
okay. Yes, everything improved except practice. Yes, practice, it's behavior, of course, it's something that takes a gradual process. I actually did not expect practice to change automatically. Already, they have a kind of a form of practice up to 50%. So I was not expecting that it changes immediately because the environment need to be taken care of, then policies and other things for practice to really improve. We have only increased their knowledge, their perception, their self-efficacy, but then other other environmental factors will have to be in place, and then behavior will have to take its gradual process to improve. I think that's why practice did not quite change.
Right. So that, I mean, I think I totally agree with you, but I think that is really important. And I hope you'll have a chance to evaluate that over time. Um, how were the teachers, you talked about teacher improvement. How were they involved in this training and education process? Did they have any was that part of the program? Because I didn't see that. Or is it just because you were
Yeah,
doing it?
yes, they didn't actually. That was why I reported it as other things that happened after our intervention,
Okay.
because we actually wanted to include them, but they said they don't have enough manpower, so they cannot leave they won't be able to combine. We did all we could to be able to do. We wanted to do teacher, peer-led and teacher-led, but they were not available for that. We were able to interview them because they got interested, and once in a while they will come and be peeping to us through the window, and then we asked them to come, but they were not formally part of our project.
I know, so that's a very impressive spread because I've worked in schools in the United States and in Nigeria and in Ethiopia, and I know how difficult it is to add to their task load. And I also know the scheduling constraints in schools, and I want to point out that those same scheduling constraints affect our ability to educate health professionals about these topics because other issues are deemed more important. So I think that's really important. The last thing I want to say is that the other challenge, I think, is what you identified in terms of policy implementation and budget resources, because that's a really tough one in resource constrained places. And so I think you have great data to be able to present to policymakers to show them why this is important. So congratulations.
Thank you, ma'am.
I see a question in the chat, Esther. Were police officers invited to participate in gender-based violence training? And this is by Todd Marsha.
No, they were not invited to participate, but it was only the health worker that we involved in our team in case of any incidents, since we are accessing experience, but we did not involve the police officers.
Okay, thank you. Any other?
Hello,
Yes, there is a question by
hello,
Bernadette.
Liga.
Yeah,
Hello.
yes,
Yes,
Shakuntala.
can I ask a question?
Yes, please.
Hello.
Yes, please.
Okay.
Sorry,
First
Shakuntala.
is I wanted to compliment her. Normally
Yeah.
we take 3 steps: questionnaire, intervention, and then she did the first, just asking them without a questionnaire. That really, you need to be complimented for that, and it's real good work. My simple question is that at any stage, girls refuse to be part, like from the first, then second, third, fourth, like that. Hello.
I didn't get the question.
Can you
What
repeat your?
I wanted, I first complimented you for this excellent study, and especially because you took
Yes,
four
thank you
steps, right?
very much.
We do 3. That's really excellent. What I wanted to ask was that uh, years back, and then in between also when we did study, there were issues. What I want to know is whether the girls refuse, like first time knowing that what you are going to ask, then maybe they're willing, and then they change like that. At different stages, did they back out?
Were there refusal from girls? That's what she's asking. At any stage, at the initial stage.
At the initial stage, they were skeptical. Some of them refused. At the initial stage, when we went for the qualitative study, many of them didn't want to participate, but we still got those who participated in our focus group discussion. But then the subsequent visits, they began to see that we can actually talk about, everything about gender, and then they started becoming interested. Then during intervention, many of them wanted to join, but we already had a calculated sample size. Even though we allowed them to join, but they were not formally. They were
I
not
remember reading the whole.
in the sample size. Yes.
Okay.
I remember reading the when you made protocol, but I'd forgotten this. So really nice.
Okay. Thank you so much, Dr. Shakuntala, for your question. Can I ask Bernadine? I see your hand raised. Bernadine?
Yeah, thank you very much.
Yeah.
Thank you very much for that wonderful research. It was very insightful. So I want to find out, was stigma an issue, and how did you handle that?
yes, stigma was an issue, and that was exactly why they didn't want to even get close to me. They didn't want to even talk about it. But there were still those that were able to get close to understand what we're doing. And then when they went back, most of them live in the hostel. Some of them come from the community. Then they were talking with themselves and they eased off a little to be able to.
Okay, thank you.
Thank you.
Just before I go to Enter, can I just remind you, please fill the feedback form. Okay, Enter, I see your hands raised, please. Can you ask? I think you want to ask a
Thank
question. Yeah, thank you.
yes, thank you. And sorry about my network kicking me on and off throughout the presentation. Esther, thank you for the wonderful work. One of the questions I wanted to ask has already been asked by someone else, but the one I want to focus on, you said shame and the death threats. Those were the two leading reasons for non-reporting of a sexual assault. So how did the intervention address those two key issues?
Okay, our intervention focused on building self-efficacy and we explained to them how to go about it. I don't know, but we discussed it and they came to understand that the threats will always be there. But if somebody had not become an escape goat, in quotes, prevention will not work out. So we showed them, like how step by step how to go about it. It's not something that is done just like that. You have to find a way to win them to understand.
Mm. Sorry, I think Esther is having some internet issue as well.
Okay. The network has kicked out.
Okay,
Oh,
I understand.
sorry, I was kicked out.
Okay, I understand. Bernadine, were you? I think you
Okay,
provided
that's
her the
fine.
answer. Okay, that's okay.
Yeah,
Any other questions, or should we? It's
because
about.
Amani, did you have your hand up?
in a
Amani.
similar
work of Esther. I worked with her for the last 4
yes.
So I don't have questions.
Okay, thank you.
Okay.
Surekha has her hands raised. Thank you, Amani, for all the work done with her. Surekha, you have a please. Surekha, you could ask your question. Surekha.
Actually, I have some internet issue. I just wanted to compliment the whole team actually. The way she presented also, starting the
Yeah.
phase one, phase two, and phase three. So it seems that the WSTF grant has worked so well. And I feel so proud of the whole team, including Professor Mani, Professor Shakuntala Chabra, the way she was mentored. And it feels this whole, the kind of I was listening very carefully to your phase-wise interventions. Initially you did the surveys and the challenges, the silence, stigma, how the women were feeling, the students, and then you had the peer-led educational system. So it felt as if there is some positive energy you created in the community, and that felt very good. Because in India also we are finding that the CBV is rising so much, and as you rightly said, most of the time, women are not even reporting. And as you rightly said, the normative nature of the whole thing, the controlling behavior is considered as normal. Women are taking care of the small things like microviolence, we say, financial controlling, abusive behavior, So this is considered normal, and many a times when we want to have some intervention, even the ethical committee will say, why you are creating problems in the community by educating? Creating awareness itself is considered as a problem. So I think you have done a great job, and sometimes I feel like crying also, the way you have helped those students feel empowered. So I think you've done a great job, Esther, and I really want to congratulate whole of your team. And if you can publish this, it
Yeah,
would be very good.
this is what
Some
I was about to ask
opportunity
him.
to women feel so helpless, and if they
Yeah.
can relate with people like in Nigeria, so similarly if women in other places can feel empowered with the by reading what you have done, I think that was very good, and I really want to congratulate. And the way you presented also, it was really very good. Thank you.
Sure.
Sorry for the
Nigat,
noise.
I have a question. Nigat, can I
Last
ask?
question. Can I
Yeah,
say
last.
it? Okay.
Thank
Uh,
you, Esther. Thank you so much. I just wanted to know that the recommendation and how did the school react to it? Because there was this, feeling among students that school would not do anything, and the counseling service. So, your recommendations, do you see in any way being accepted in any manner by the school
Thank you.
authorities?
Thank you for the question. Yes,
Yeah.
if the work is disseminated, which is in my hand, if it's disseminated and the policymakers get them, then they should be able to do that.
Okay. I have a small suggestion being part of social media. Publishing is very good, but I was wondering if, the quotes which you have, if also a short film, if we can make on this. The students saying what they knew about GBV and then very short. I mean any student could do that. So that could also, because these days, all the students on Instagram and media, they're more on visual. So if you could do that, that would be also great. I mean, if you need any
Yes,
help,
I think I even
publicity.
have.
Yeah.
Yes, I have video recordings of their plays and their sensitization programs.
Okay, yeah, but that would need to be edited, like, having those quotes from the
Okay.
students, which you have put on the slide,
Okay.
So the students speaking those quotes and, and very short, not very big. So that could, yeah, help as well. Yeah.
Okay. Thank you. Thank you.
That's a good idea because it means you can go back and take short videos, from those students speaking on this. When peer-to-peer kind of message helps, when the young people see that on social media, seeing their fellow young person speaking to them on this, those short videos like suggested might really help.
Thank you. Thank you.
The hand that is up.
Nigat, unmute yourself. Nigat, can't hear you.
Okay, sorry. Yes, I said my special thanks to the speaker, Esther Umahi, for your wonderful and inspiring presentation. I think if we look around, I think it's many countries face this problem or globally all over the world. And the point is that how many are really making serious efforts. And it's more like an evidence-based intervention, and then I think this is something more has more impactful for all of us. So thank you, Esther. Thank you, all of you, for being here today. Each one of you very special to me. My members, WHTF members, founding members, board members. Thank you, and of course our some of the participants. I think few of the participants who decided to attend this, thank you to all of you for being here. And I hope you have, like for all of us, this has been a wonderful learning also how to take back message home. Thank you. So should I?
And if you're new, please think about joining us.
Yes, please go to our website and Women in Health Together for the Future.org, and you will find that you have opportunities to, become a member. So we would like very much, each one of you who are new to us, new to WHTF, please do become a member and contribute. We would love to have you on our board, as members. Thank you. Should we, Judy, could you stop the recording or?
Sure.
Thank you.